The number one question is, how can I get longer or how can I get more girth? Well, today, we are going to address those questions and give you the evidence behind penile lengthening treatments. If you like what you see here, make sure you subscribe so you can see new videos every week. So, did you guys know they surveyed 50,000 heterosexual men? And what they found was that 55% of them were unhappy with the way their penis looked. When they asked those men's partners, 85% of women were satisfied with the way their partner's genitals looked, but it matters how you feel about your appearance. But there are a lot of issues with that because pornography has blurred the lines of what exactly is normal. The average penile length. An average penile length. If you look at all the data, approximately the average penile length is about 5.2 inches or 13.2 centimeters, and it's normal for penile length to be within 2.5 standard deviations of that, so either greater or smaller. And so what's abnormal in terms of length is too short would be anything less than 2.9 inches or 7.5 centimeters, and that's called micropenis. The micropenis is prevalent in less than 1%, 0.14% of the population, so it's extremely rare. It's because of several causes that can include congenital abnormalities, hormonal abnormalities, previous surgeries, or cancer. But today we're going to talk about people who have a normal penile length. So while the large majority of people are concerned with the size of their penis having a normal penile length based on these numbers, the true issue is that a significant portion of men can have distress related to the idea that their penis is not as long as they desire. And this is body dysmorphic disorder has a term, it's called small penis anxiety. It doesn't mean that they have a small penis, but they have anxiety related to the fact that they believe that the size of their penis is not long enough, and way this is defined is that people have a preoccupation or obsession with the size of their penis, which they spend over 1 hour a day thinking about this, and some portion of these men can be so distraught that it can affect their activities of daily living. And some of them can end up in the hospital because of their overwhelming obsession, or even have suicidal ideation. This is not a joke, this is serious. This can have real serious complications for people, and so we think it's important to talk about this because this is part of men's health. The other major issue with this problem is that if you Google, "How am I going to make my penis longer?" you'll be overcome with tons and tons of websites and information that may or may not is reputable. Many people will go abroad or find non-licensed providers to do things to them that can have dramatic consequences, so please don't do that. Look for a reputable urologist, psychologist to help you with these issues. We will also preface the rest of the information that we going to share on this video by telling you that the Sexual Medicine Society of North America states that procedures for penile lengthening or we do not recommend girth enhancement, and considered experimental unless they are in someone who has a micropenis. So, the things we are about to tell you are in the literature for urology, and have some data to support them. However, before doing any of these things, please establish care with an urologist who is familiar with these things. As a caveat, we researched for you guys. There are 2 categories of treatment options available to people who suffers from small penis anxiety or distress because of the belief that their penis is smaller than normal. And for those people there are non-surgical treatments, and there are surgical options that are reported in the literature. Starting with non-surgical treatments, psychological counseling. So there are validated measures and questionnaires, and assessments that can be done to help you understand what normal penile size is, and also help you deal with some of these anxious feelings Interestingly, when you look at people who've undergone just psychological counseling and nothing else, the large majority of men no longer want to look for any other treatment, whether it's non-surgical or surgical, to enhance the length of their penis. So this is big. We would recommend anyone who's suffering from anxiety to please seek psychological care to help you with this anxiety. There are 3 other non-surgical options. Also, there are some complications. This can include numbness, bruising, or, overall, just lack of efficacy. You can spend a lot of time do this and see no benefit. So, this is the only thing that has been shown in the literature to have consistently excellent results with very low side effects. The other options, vacuum erection devices, specifically did not increase the penile length at all. And last, penile injections. There are several penile injections out there that have been tried using, and many of them have had devastating complications. So we do not recommend doing any penile injections. Again, right now, the data is not strong enough to recommend any sort of injection in the penis, and, as we mentioned, you can have devastating complications up to 40 years after getting a penile injection. So please inject nothing into your penis as far as surgical treatments. A lot of different surgical options have been discussed and written out in the literature. One of the most common ones is a suspensory ligament incision. And what that is, the penis is held to the pubic bone, which is the bone right in front of your penis, by a ligament, and by releasing that ligament, you can give a little more length to the penis. However, this is not without complications. There are also several, and even using rib cartilage, other techniques using different flaps grafts to help increase the length of your penis, and these overall have poor outcomes with poor satisfaction. In the studies that have been able to give results, these particular surgeries have not been really rigorously reported. So, we cannot recommend a surgery to increase your penile length that is not without a multitude of complications. The only time that you should proceed with any surgery for penile lengthening would be in the context of a clinical trial. And what is a clinical trial? Well, a clinical trial is done at an institution where there is an institutional review board, or IRB. What that IRB does is make sure that any study that is done in that the institution is safe and ethical to be done on human patients. They also make sure that there is data monitoring and a way to report adverse events that occur during the trial regularly. So, that thing that happens because of the surgery is accurately documented. And then those things are published in the literature so that you can get truly clear and complete data from a study that's being done on a certain type of surgery. And so that we can say, okay, this has been done in 100 patients, and only 10 of them had a complication. And that was minor compared to 20 of them having a horrible complication. And then this is not safe for us to continue doing, and this is how we look at data scientifically to make sure that it has good outcomes and is safe for people to proceed with doing. Bottom line, there's not a lot you can do to change the length that you are given. You can gain a small amount of length with penile traction therapy, and that has been shown in the literature. However, there are many other things that are currently under investigation and are not recommended for routine care. We think foremost is getting treatment under the care of a psychologist to deal with this anxiety before doing anything that may be irreversible and have you ended up with something that is disfigured, not functional, and worse than what you started with. Thank you so much for watching, and always remember to take care of yourself because you're worth it.